Good afternoon, everyone. Thank you so much for joining us for the Acting on the Sappa webinar. We are so glad that you've joined us for the release of the Strategic Action Plan on Aging Implementation Toolkit. We'll be sharing more information both on the Sappa and on the toolkit with you all this afternoon. Welcome. All right. So my name is Haley Aka, the Associate Vice President at the Health Policy Institute of Ohio. And for this afternoon's webinar, I'm going to be joined by Ashley Davis, Chief of the Ohio Department of Aging's Elder Connections Division, and Morgan Fitzgerald, State Plan and Area Plans Manager with the Elder Connections Division at ODA. From our team at HPIO, you'll also be hearing from my colleagues Carrie Almasy, the Senior Policy Analyst, and from Stephen Listison, a Health Policy Analyst. We also want to take just a moment and acknowledge that this has been a trying 2 years. So thank you to each person on this call today for your tireless efforts to support older adults and Ohioans in general during the pandemic. The Ohio Department of Aging contracted with the Health Policy Institute of Ohio to facilitate development of the Strategic Action Plan on Aging Implementation Toolkit. We're so grateful to members of the Sappa Advisory Committee and to other Aging Network partners who contributed feedback, ideas, expertise to inform this work. For those of you who aren't familiar with the Health Policy Institute of Ohio, we are an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. We'd like to make this webinar as interactive as possible and as time permits. So if you have questions for us, please type those into the Q&A box. We'll be looking at those throughout the webinar. And we'll also be doing some polling using the chat box for discussion. So we would love to see you over in those features. Here's the agenda for our webinar today. I'll give you a few seconds to review that. And here are our learning objectives. I'll give you a chance to look those over as well. Before we get started here, we do have just a brief poll question for you. I'm going to ask my colleague Alana to throw our first poll question, which is, how familiar are you with the Sappa? Are you really familiar? It guides your work. You're pretty familiar, you've reviewed it, you've used it. Somewhat familiar, you've glanced at it. Or you're new to this conversation and want to learn more about what the Sappa is. So you can go ahead and vote. I've got someone asking for the agenda again, so I'm going to put that up as we do this. Happy to do that.
Let me know when you're ready for results, Haley.
Sure. Okay, great. So we've got a variety of familiarity levels, which is perfect. We've got some old pros with the Sappa. We've got some new faces. Thank you all so much for being here and for joining us and for this feedback. I'm going to now throw it over to Ashley Davis and Morgan Fitzgerald from ODA, who are going to walk us through an overview of the Sappa, particularly for our folks who are newer to the work.
All right, thanks so much, Haley. First, I want to, on behalf of the Ohio Department of Aging, really thank you for your commitment to the Aging Network as partners and as stakeholders, and for joining us this afternoon to learn more about the Sappa and more about the Sappa Implementation Toolkit. So before we dive into the toolkit, I'd like to start us off with a brief overview of the Sappa. All right, The Sappa was released in March of 2021, and it is a prioritized plan to advance elder justice and equity and to achieve optimal health and well-being for older Ohioans. The Sappa lays the foundation to ensure that all partners in the aging network are rowing in the same direction and to improve the health and well-being of older Ohioans. The Sappa builds on three key publications, and those three documents are the 2020 Summary Assessment for Older Ohioans, the 2019 to 2022 State Plan on Aging, which ODA completed in 2018 as a requirement for the Federal Older Americans Act, and the 2020 to 2022 State Health Improvement Plan, or the SHIP, which is a tool to strengthen state and local efforts to improve health and well-being and economic vitality in Ohio. So why is having the Sappa important? So having a document like the Sappa is important for many reasons, but one of the key reasons is that aging is a universal experience and one that should be valued and celebrated. Older Ohioans make substantial contributions to society, including working, volunteering, caregiving for young children and other family members, and serving as community leaders and mentors. Often these contributions go unrecognized and uncompensated. As described in the summary assessment of older Ohioans also face obstacles to health and well-being and are not always afforded the opportunity to age with dignity, respect, and autonomy. By 2030, older Ohioans 60 plus will account for more than a quarter of Ohio's population, 26.3%, up from 19.8% in 2010. Supporting healthy aging and valuing all older Ohioans in the face of this changing landscape is critical. This is our conceptual framework for the Sappa, and it highlights several things. At the top in green, you'll note the vision and the goal of the Sappa. The Sappa priorities are in that middle section in the blue and the gray boxes. And then our key principles, our key Sappa principles are in red and orange boxes at the bottom, which really are our foundational components of elder justice and equity. So as you can see the goal and the vision a little larger here. So the goal is that all Ohioans will live longer, healthier lives with dignity and autonomy, and that disparities and inequities are eliminated. The Sappa vision in Ohio is one that aligns with our vision as an agency, and that is that Ohio is the best place to age in the nation. This means ensuring that Ohioans live longer and extending older Ohioans' healthy and active years. Another key component of the Sappa framework are the priorities. The Sappa priorities answer two key questions. What factors impact health and well-being of older Ohioans? And how will we know that the health and well-being of older Ohioans is improving? There are 6 topics and 15 issues prioritized in the Sappa to answer these two questions. And the Sappa strategies and objectives are organized around these priorities. And then foundationally, the Sappa emphasizes the need for systemic change to achieve elder justice and equity, which are why these two key principles are in the conceptual framework. Elder justice, as defined in the Sappa, requires fostering and promoting systems, beliefs, and policies that value aging and dismantle ageism. Equity, as defined in the Sappa, requires dismantling ageism and other forms of discrimination, such as ableism and racism.
Thanks, Ashley. The Sappa content is structured such that it provides a comprehensive roadmap for public and private sector partners to achieve the Sappa goal. First, it prioritizes 15 issues across the 6 topic areas focused on in the Sappa. It also tracks progress on the 19 outcomes and 26 SMART objectives. It highlights opportunities to advance elder justice and equity. It provides a menu of evidence-informed strategies and resources to improve outcomes across the issues prioritized in the Sappa. And it outlines recommendations for data reporting and evaluation. To demonstrate how all of these Sappa topics, issues, and outcomes tie together with the SMART objectives, let's walk through an example. So population health is one of those 6 topics in the Sappa. Within population health, mental health is one of the 15 issues prioritized in the Sappa. Within mental health, the outcome that we are trying to achieve is to reduce depression. Then, reduce poor mental health days is the SMART objective that we've identified for reducing depression. This objective is measured by the percent of adults ages 65 and older who reported their mental health was not good for 14 or more days in the past 30 days. This is measured by the Behavioral Risk Factor Surveillance System as compiled by America's Health Rankings. To ensure that objectives are specific and measurable, each objective includes at least one indicator from a source that is publicly available and updated frequently. Elder justice and equity are addressed in the Sappa through 4 primary ways. First, by providing key considerations for advancing elder justice and equity. The Sappa includes overarching considerations, such as creating an age-integrated society and dismantling systems, policies, and beliefs that devalue aging, and also provides considerations specific to strategy implementation within each of the Sappa strategy sections. Second, by identifying priority populations. These icons represent the 9 different priority populations identified in the Sappa, either based on available data or through expert feedback. Third, by highlighting strategies likely to reduce disparities and inequities. And fourth, by setting specific targets for our SMART objectives when the data is available to eliminate disparities and inequities. And then before handing it back over to HPIO, I just wanted to highlight our webpage where the Sappa and related materials are located. The full Sappa and the implementation toolkit presented today can be found by visiting the Ohio Department of Aging's website, and that is at aging.ohio.gov/Sappa. The webpage also has contact information for how to get in touch with us if you have questions related to the Sappa, and there's a link to sign up for Sappa updates. So that concludes this portion of the Sappa overview, so I'll give it back to you, HPIO.
Thank you. Thank you so much, Ashley and Morgan, for that overview. It really sets us up so nicely to talk about the new tools that we're releasing today, which is all about the Sappa implementation toolkit. And I'm so glad that you shared about the website. The toolkit is live right now. If you go to that page that Morgan shared about, my colleague Carrie also dropped a link in the chat directly there. So if you haven't seen the toolkit already, we invite you to go take a look after today's session. And in the meantime, we're going to talk about the purpose of the toolkit. The Sappa implementation toolkit is designed to strengthen implementation of the strategic action plan on aging. So the toolkit provides guidance, best practices, tools, resources that state and local partners can use to move Ohio toward a more comprehensive and coordinated system that empowers older Ohioans and advances healthy aging. There are 6 sections of the Sapa Toolkit. They provide guidance and information on how to implement each of the 6 Sapa action steps that you see here. So the Sapa Toolkit is organized by these 6 topics, and there are tools and resources for each. As Ashley and Morgan shared, the Sapa provides a really comprehensive roadmap for achieving the vision that Ohio is the best place to age in the nation. However, that vision, right, it can only be achieved if we use the roadmap, if the Sapa is put into action. So the toolkit is that place that provides a one-stop shop for how you can act on the Sapa. It gives you all the information that you need to play a role in Sapa implementation. As you see here, the Sapa toolkit can be used by a wide range of public and private partners at the state and at the local level. The toolkit was designed with this broad audience in mind. You can see all the sectors represented here. Before we give you a flavor of what type of information is in the toolkit, we'd like to just pause here and provide some opportunity for discussion. So please type in the chat. We've been seeing a few comments come in through there. We'd love your answers to this question. How does your work connect to the Sapa? What connections do you see to the Sapa topics that Ashley and Morgan shared? What connections do you see to the goals that the Sapa is working to achieve, to the foundational factors it's built on? Right? How do you see connections between your work and the Sapa? And as those come in, I'm happy to read some of those off. This is also a great time to ask questions of the HPIO team or the ODA team. We welcome that. And I'll just pause here and allow for those to come in. Fantastic. I see no cost legal assistance for low income and minority seniors to understand and enforce their rights. I see connections to the services and the topics listed in the Sapa. See folks who are working with many of the priority populations identified in the Sapa. Age-friendly initiatives that have much to do with healthy aging. APS is linked to the elder justice priority directly. Right, and you can see some of these in the chat as well as they're coming in. This is fantastic. A senior working with seniors to help them remain independent in their homes. Fantastic. So many good ones. All right, we'll keep those coming in. It's great to hear from each other about how we're advancing this work and how your work connects to the topics of the priorities identified in the Sapa. As you guys type those in and as you ask any questions that you have of us, I'm going to turn it over to Carrie Almasy from our team, who's going to start us off with a peek inside the Sapa Toolkit.
Thanks, Haley. I'm excited to have the opportunity to unveil some of this great content for you. So I'm going to walk you through an overview of some of the first pieces of the toolkit. It is broken down into 6 main sections, which you can see listed here. They each align with different types of actions you can take to implement the Sapa, and they each contain a ton of great guidance, tips, considerations, and resources. Within each of these sections, you'll find each of these elements. So there are examples of partners in action that illustrate what this work can look like in different settings. There are considerations to advance elder justice. There are key resources, and there are tools, which are interactive resources and worksheets that go along with the content from that section. So I'll start by briefly walking you through some of the highlights from each of the 6 main sections. The first section provides information and guidance on how partners can advance elder justice. This means fostering and promoting systems, policies, and beliefs that value aging and prevent elder abuse and neglect. For instance, this section, one of the things it provides is information on the way that discrimination can impact older Ohioans and operate at different levels of society. It also provides examples of action steps that can be taken at the individual and at the systemic level to eliminate discrimination. So you'll find all that great content. The section also includes 6 steps that public and private partners can take to prevent and mitigate the impacts of elder abuse and neglect. So you can see those on my screen. I'll give you a minute to look those over. But this all lives in the toolkit with a lot more detail. And then the worksheet in this section is a tool that is meant to be a one-stop shop of key elder justice questions to consider. So as you're going through implementing the Sappa, it's a place to catalog your discussions and decisions along the way. The second section provides information and guidance on how partners can align with the Sappa priorities. It helps identify opportunities to strengthen your focus on Sappa priorities and with Sappa priority populations. Because of the breadth of topics and issues covered in the Sappa, the really good news is that your priorities may already be aligned. And on the other hand, you may also want to consider new or additional opportunities for alignment with the Sappa to increase your ability to effectively address the needs of older Ohioans. This may be especially useful when you're undergoing a change to your areas of focus, such as through strategic planning or through a community planning process. To go along with that, the worksheet provided in this section is designed to walk you through each step of that prioritization process, to make it really simple for you. Then the third section in the toolkit provides information and guidance on how partners can build and sustain strong relationships and engage older Ohioans. This includes working together with other partners, older community members, and priority populations to support healthy aging. We know that supporting healthy aging requires buy-in and focused engagement from a wide range of partners. We also know that many of you are already engaged in long-term existing partnerships in this space. So this section is meant to be a resource that includes examples of the many different types of groups and organizations that could come together and collaborate on Sappa implementation, ranging from things like advocacy organizations to area agencies on aging. There's a multitude of different types of partners that can come together and collaborate in this space. This section also provides information on how to engage older Ohioans as partners in your work. There's a whole spectrum of activities you can undertake to engage older Ohioans and priority populations. The further you go along the spectrum, the greater the opportunity for community involvement, impact, trust, and communication. But there are many opportunities to engage older adults throughout the process, and you can see some examples here. They're also available in the toolkit with a lot more detail, but there's a lot of different ways that you can engage community members as you go through this work. And I just want to give you a glimpse of the worksheet included in the section. It's meant to help you inventory current and new potential partners for your work, so you can keep all that information together in one place. So now I'm going to hand it over to Stephen to walk you through the rest of the content overview.
Thank you, Carrie. My name's Stephen Listison. I'm a health policy analyst at HPIO, and we're very thankful that everyone could join us today. I'm going to continue on with the fourth section of the Sappa Toolkit, Implement and Fund. This section contains guidance for partners on how to find, prioritize, and implement effective policies and programs to promote healthy aging. And as Ashley and Morgan covered earlier, the Sapa includes a comprehensive menu of evidence-informed strategies, and this section includes guidance for using that menu and implementing your chosen strategies. The toolkit contains these 4 action steps for implementing Sapa strategies: collaborating with partners, leveraging community strengths, communicating goals and plans, and beginning strategy implementation. For each of these 4 action steps, there are questions to consider so that you and your partners can get on the same page on how to implement the strategies that you have selected. Here's a closer look at the first action step: collaborate with partners. You see those questions to consider in the yellow box. There's also information in the red box describing the importance of including the perspectives and experiences of older adults and people from priority populations. You'll also notice throughout the toolkit that there's information related to elder justice accompanied by the scale icon. There are 2 additional tools in the Implement and Fund section. The first of such tools is a strategy selection worksheet. This is a fillable rubric that walks you through the same selection criteria and provides guidance for comparing strategies that you may be considering. The second tool is a strategy implementation worksheet, and this guides you through considerations and action steps for implementing a Sapa strategy. Next, we have the 5th section, advocate. This section describes how partners can advocate for funding and policy change that lay a foundation for healthy aging. There are several types of advocacy, from raising awareness through research and educating policymakers to lobbying for change to legislation. Depending on the type of organization you represent or the conditions of your funding, some of these types of advocacy may be more accessible to you than other types of advocacy. But regardless of the method that you choose, advocating for policy change is critically important. It's an important way to influence decision makers who have the power to achieve the goals and targets that we've set in the Sapa that we described earlier in the issues facing older adults. Advocacy is also a way to elevate the voices of older Ohioans and share their perspectives and needs with our policymakers. There are many types of advocacy activities that you or your organization can engage in. There are some low-touch activities, like raising awareness on social media. These are fairly easy and can reach a large audience. There are also high-touch advocacy activities, like meeting with policymakers, and these are more targeted and may have a more direct impact on the policymaking process. The toolkit includes information about balancing your advocacy approach with several different activities. The worksheet for the advocacy section is designed to help you define the goals and approach to your organization's advocacy efforts, or your own advocacy efforts. Finally, the last section in the Sapa implementation toolkit is evaluate. This section provides guidance on how to evaluate your progress, measure your effectiveness, and engage in continuous quality improvement. The evaluate section also provides guidance in 3 categories. First, identifying what you are going to evaluate, such as specific strategies and outcome. The second is identifying how you are going to evaluate, things like choosing data sources and action steps for evaluation. And finally, This section provides guidance on identifying how you're going to use the evaluation results to continuously improve your efforts. The basic logic model template included in this section is a tool to help you develop a logic model for your evaluation efforts. A logic model is a diagram that shows the relationship between the services or programs that you provide and the things that happen as a result. It serves as a foundation and guide for evaluation work. The template includes instructions, examples, and a blank template for you to create your own logic model. The second tool in the Evaluate section is an evaluation plan template. This template can help you develop a plan for measuring the effectiveness of that implementation work that we've been discussing. Finally, the toolkit provides an alignment tracker. The alignment tracker is an interactive tool that does two things. It serves as a central hub for all the worksheets and templates included in the Sapa implementation toolkit. And you can find links to all of them here and in order you might want to use them. This interactive tool also allows you to document the Sapa priorities, priority populations, and strategies that you or your organization have chosen to focus on. That was a brief overview of each piece of the Sapa implementation toolkit. And now we have another quick poll question for you. So there's the poll question. It asks which section of the Sapa implementation toolkit you're most excited about or is most relevant to your work. So these just cover the 6 different sections that Carrie and I just talked through, and we'd really appreciate an answer on this.
We're getting lots of responses, Stephen. So maybe in just a second, I'll
Awesome.
share that for you. Okay.
Thanks, everyone. Okay, wow, we have a variety of answers, but the most excited about or relevant is partner and collaborate. We really love to hear that, and we know that's a critical part of everyone's work in the aging network. So that's really great. But we know that all 6 are very important in implementing the Sapa. Thank you all for your responses and your attention throughout mine and Carrie's presentations. We really appreciate it. And we've been sitting for a while. So now we invite you to participate in a short activity break, stand up, move around, do jumping jacks, whatever gets the blood flowing and gets you ready to pay great attention to the rest of our great presentation. Thank you.
Thank you so much. Thank you so much, Carrie and Stephen. Thanks to all of you for your participation. I'm going to sit in my seat and stretch a little bit as we prepare for our next section of our discussion today. All right. So we're going to discuss here for a few minutes some examples of how you all can use the Sapa Toolkit. In each section of the toolkit, there are in fact examples that showcase how partners can act on the Sapa. So this is just one example. It's from the Implement and Fund section. This example discusses long-term care providers who are really attuned to the mobility and the physical activity needs of their residents, which is a great opportunity to implement some of the physical activity programs from the Sapa. The tools in the toolkit provide guidance and resources that can help you identify those evidence-based programs and identify which programs might be the best fit. Here's another example of partners in action, and this is from the partner and collaborate section. This example focuses on places of worship like churches, synagogues, mosques, temples, who often provide free meals to community members. So to expand the reach of those efforts and to focus on older adults, a place of worship could partner with senior centers or other meal providers to establish a nutrition service program. The partnership worksheet and guidance in the Sapa Toolkit can support those efforts and give you a place to document your efforts there. There are examples in the toolkit for a wide range of partners and in every section of the toolkit. So whether you are new to the Sapa or have a lot of experience with the document, whether you sit at the state level or you serve a local community, there are examples in the Sapa toolkit that could give you a sense of how you might utilize this plan. Speaking of examples, today we'll be hearing from 3 partners in this work. Our guest speakers are going to describe how they are implementing the Sapa, how it's adding value to their work, and the value that Sapa alignment holds for other aging network partners. So we're going to start with Amy Boehm, who is the Health Systems Director at the Alzheimer's Association.
Hi, I'm Amy Boehm. I'm with the Alzheimer's Association and serve as the Health System Director throughout the state of Ohio. And thank you so much for having me on today to talk about my experience in using the Sapa and the ways that the Alzheimer's Association in Ohio is utilizing it to propel the work that we're doing. In 2019, the Alzheimer's Association, we launched our health system initiative to really look at ways that we can go from just being seen as a social service agency to also being in that public health sphere. So the timing of the planning for the Sapa for us came at a very, very good time because we were starting to focus on some of the key priorities that were identified in the Sapa. It was really also a great experience to be part of some of those work group discussions as well to narrow down those priorities. But not only that, to be able to see the other stakeholders from around the state of Ohio, those that found value in this work as we all work collectively to try to make Ohio one of the best places to age across the nation. So when we talk about how the Alzheimer's Association, how we have implemented and utilized the Sapa, when the Sapa was released, one of the first things that I did as a health system director, because I work throughout all of the chapters, and we have 6, we're very fortunate to have 6 chapters here in Ohio, I made sure to meet locally with the executive directors and some of the other program directors staff to kind of review what the Sapa held and figure out together how the priorities of the Alzheimer's Association overlays with what the priorities of the Sapa, the recommendations out of the Sapa. Some examples of that, you know, when the Sapa identified social connectedness as one of the key priorities, you know, certainly at the Alzheimer's Association, we have done a fantastic job building support groups and education programs to address those seniors dealing with dementia as well as brain health. So we were, you know, that was another way for us to kind of satisfy our needs and our goals, as well as some of the work in the Sapa. Another great example of that under public health or population health, sorry, looking at ways to increase cognitive health as well as decreasing depression and addressing hypertension. The Alzheimer's Association, we're partnering with IHI, age-friendly health systems, to encourage more and more health systems across the country, but of course right here in Ohio, to become age-friendly. And So I am supporting them in this work in addressing ways that they can become designated as an age-friendly health system. And in doing so, they're looking at things like mobility, fall risk, mentation, so looking at depression and delirium and dementia, as well as what matters and medication. And all of those things align so well with the work of the Sappa. The other thing that I would say in the work of the Sappa, it also offers another great tool as I'm going out and talking to health systems about making positive changes to for timely detection of dementia, as well as improving the quality of life for those after the time of diagnosis of dementia. It's just another tool in the toolbox. So it's not just the Alzheimer's Association going and saying this is good work and you should be doing it. It's also being able to show health system leadership and administration the key findings that came out of the Sappa, as well as the recommendations. So not only is this important to the Alzheimer's Association, but it's important to other key stakeholders, as well as the ODA right here in Ohio. As we look at how the Sappa is continuing to move us forward, we're really excited in Southwest Ohio. We are pulling together health systems this spring to come together and talk about ways that they can address the early and accurate diagnosis of dementia, as well as improve that quality of care after the time of diagnosis. And we're pulling in ODA to come in and speak. And we want to make sure that's an important piece of our day. But in addition to that, making sure that we're referring back to some of the key findings and the facts presented in the Sappa as well. Again, so it's not just the Alzheimer's Association saying that this work is great. We have other key organizations and stakeholders saying this work is valuable as well. When we take a look at why other partners should take a look at the Sappa and find it valuable, I think it does a great job of providing evidence-based solutions for those key priorities and the outcomes that we would like to see out of the Sappa. So you not only get to see those recommendations, but the Sappa provides resources and evidence-based solutions for organizations to continue to move this work forward and inform the work that you'll be doing as an organization. It has been an absolute pleasure to be, like I said, part of the planning of the Sappa, but not only that, utilizing it in our key strategies that we're developing and our everyday work here at the Alzheimer's Association. So thank you. Hi, I'm Amy Bain. I'm with the Alzheimer's Association.
Fantastic. We're so glad to hear from Amy. Our next speaker is Annette Sager, who is the owner of the Gilchrist Center. So we'll hear from Annette next.
Hello, everyone. I'm Annette Sager, president and owner-operator of the Gilchrist Center in Wayne County, Ohio. I'd like to share with you how we got involved with the Strategic Action Plan on Aging, also known as the Sappa. Like so many of those who own and operate adult daycare centers, 2021 was a hard challenge for all of us. Being closed for nearly 7 months, we needed a fresh start and a good sense of direction to move our company forward. We leaned on the Sappa to help us renew and reinvent our center. We believe that the Sappa could help other organizations who might be in a similar situation as we have been. There are many other ways Sappa could add value to your company by utilizing Sappa and partnering with other local organizations in your own area. We use the Sapa Guidelines that outline the areas of our seniors needing help and show how we can implement these tasks while still following health guidelines. These are the steps that the Gilchrist Center has implemented through the Sappa. One of the steps we used was the financial stability strategy. We have offered many of the bankers to come in at different times of the year and speak with our seniors on fraud and abuse. They would ask questions about phone calls that they may have received asking them for their personal information or their financial information. And our bankers have actually given them direction on answering those calls. That has been a huge help for our seniors to save them from the abuse and fraud that is happening rampantly for them as they age. Our housing affordability, we use the Sappa to help direct us in how we can assist our seniors in getting affordable housing through AMHA or through our coalition, through our JFS in our own county. Our transportation strategy, we partner with the state MCOs, someone like United Healthcare or CareSource or Buckeye. We also used Wayne Medina County Community Action, which actually helps our seniors with transportation. And we try to offer the best transportation through these insurances for our seniors so they don't have those concerns. Transportation can be very difficult for seniors to get their way around to either medical or non-medical transportation runs. So we reach out through guidelines from Sappa to assist our seniors in that. We improved our nutritional program by implementing some new food educational programs to include and supporting the healthy eating. This consists of classes that we have offered our seniors, handouts so that they can take stuff home, and understanding the benefits of good nutrition. We also expanded our menu, including whole foods, some fresh foods, especially special diets, and even farmers market when that's available. Activity program through the Saffit has been a good guidance for us. We have added an exercise program to improve our seniors' health, strength, and balance. Examples that we have done, we have used chair Tai Chi, chair yoga, dance and fitness exercise, and matter of balance. These are programs that are offered through our center for our seniors to help strengthen them and prevent falls. We tie this in with our fall prevention program that we offer to our seniors. There's so many times with the dangers of living alone that the fall risks are very high. So we try to strengthen them through the exercise program and offer the help that we can. Our caregiver support has been really well received. That is one of the areas that we are very concerned. While we love our seniors and take care of our seniors, our caregivers are sometimes left out of that or not looked upon as much as they should be. So our program for the center, through our assistance of Sappa, we have given our caregivers and families, we host caregiver support group meetings. Examples would be our Parkinson's group, our Alzheimer's group, and we let them know that they're not alone in this journey and that we can help them and we understand. We also, through Sappa assistance, have put together a volunteer program. The Gilchrist Center has recently added volunteer program. We have many volunteers from an array of backgrounds, such as music and art, nursing, construction, teachers, and business. They come in and they interact with our seniors, and it's been an amazing thing for our seniors to have. They will come in and spend an hour to 2 hours. We have actually people who will come in and play music instruments for us. The seniors love that and receive that well. There's just so many different areas of Sappa that will improve your center. If you reach out and look at the benefits from Sappa, I'm sure that you'll be able to find many ways to enhance or reinvent your center. We've enjoyed the Sappa program and are planning on continuing utilizing that moving forward with our centers. I also sit as the president of the association. It's the Ohio Adult Day Healthcare Association. And we have started, and we have shared the Sappa program with as many as 70 daycares across the state. I've also had the opportunity to work on closing the language barrier by working with a diverse adult daycare owner who speaks Somalian. I do not speak that, but one of their directors speaks a broken English and Somalian. So we met with them and we shared some ideas of how to reinvent their center and follow the Sappa program. So it has been an exciting thing to be able to be a part of that and do that. There's been exciting tasks. There's been many exciting tasks for our association working with these daycares across the state. We also had Miss Ashley Davis present Sappa to the association, and it was very well received. We answered many questions and want to continue working with the Department of ODA on Sappa and look forward to the exciting things coming. I'd like to thank Director Ursel McElroy and her team for all they do and have done in improving the lives of our aging population of the great state of Ohio. And this is from the Gilchrist Center in Doylestown, Ohio.
Fantastic. We're so thankful to have Annette share with us as well. Our final guest with us this afternoon is Misty Crosby. She's the Executive Director at the Buckeye Hills Regional Council. And Misty is with us live today. So Misty, we're thankful to have you.
Thank you so much, Haley, and good afternoon, everyone. I really want to thank ODA for inviting me to speak today. As mentioned, I'm Misty Crosby. I'm Executive Director of Buckeye Hills Regional Council, and we are a council of governments serving residents in Southeastern Ohio. We work collaboratively with our elected officials in our region. We grow strong communities through our 5 divisions, which include the Aging and Disability Division, Community Development, Mapping and Data, Population Health, and Transportation Planning. So we wear many hats here at the council, first and foremost being that of a council of government, working with and for our local governments to better serve our region's communities, as well as serving as the Area Agency on Aging for our region and the District 18 liaison for the Ohio Public Works Commission, and as an economic development district and a local development district and a regional transportation planning organization, and also the Southeast Ohio Aging and Disability Resource Network. And our days are full, but we have served residents in some of our state's most rural and remote counties since 1968. Our population includes a high proportion of 3 of the 9 priority populations that are identified in the Sappa. So all of our residents are in rural Appalachia. Many have low incomes and low levels of educational attainment, and many of them live alone. So in the short time we have today, I'd like to share how the council works to serve these priority populations in alignment with the Sappa. And in particular, I'll touch on how our mobility management and our community health worker programs are aligned with the Sappa and helping our region's residents to live longer, healthier lives with dignity and autonomy. So Southeast Ohio has historically been medically underserved. Our region is home to some 260,000 individuals scattered across 3,700 square miles. We have 2 hospitals, one in Athens and the other in Marietta. And our smaller communities outside of these 2 cities are served by a handful of clinics and satellite emergency departments. And this is layered with our home and community-based provider network of about 140 providers, many of which are essentially small-scale mom and pop operations. But despite our rural challenges, mobility management is one of the areas where we are successfully connecting residents with the care they need. So before 2020, 3 of our 8 counties, Washington, Monroe, and Noble, lacked a mobility manager. And Washington is our largest county by population, while Monroe and Noble have Ohio's highest proportion of individuals 60 and older in Ohio. So in 2020, we worked with ODOT and our local partners, and we launched a pilot program in Washington County to improve awareness, coordination, and delivery of transit services. And in the past year, this effort has grown to include Monroe and Noble counties. And beginning this year, we have 2 dedicated mobility managers serving these 3 counties. In our first year, our Washington County mobility manager has directly helped connect more than 150 individuals to rides for medical appointments and more. And during the pandemic, we also connected the local transportation providers with CARES Act funding to mitigate the impacts of COVID-19 on their operations and riders. This really included providing them with personal protective equipment, mileage reimbursements for grocery and pharmacy rides, and vehicle disinfectant equipment and supplies to keep their riders safe. Our mobility managers have also helped Washington County update its coordinated transportation plan and develop the first such plan for Monroe and Noble counties. These locally developed coordinated plans identify community resources for transportation and mobility the gaps and unmet needs within those resources, and determine the approach to addressing those gaps and unmet needs. Federal law requires that these plans be developed and approved through a process that includes participation by all kinds of folks, including seniors, individuals with disabilities, representatives from the public and private nonprofit, transportation and human services providers, and other members of the public. Partnering and collaboration is at the root of all the things that we're doing at the council. Another way we are improving access to care in Southeastern Ohio is through our new community health worker partnership with Ohio University. So in 2020, we reached out to Ohio University to learn more about their community health worker certificate program and to figure out ways for it to align with what our work at the Area Agency on Aging and Buckeye Hills Regional Council is. So the students in this program are required to complete experience hours, and the program has oversight from the Ohio Board of Nursing. These students, most of whom are non-traditional college students, are helping us ensure that older adults are actually getting the care they need when we make a community referral. So as an Area Agency on Aging and a passport administration agency, Buckeye Hills makes community referrals after a long-term care consultation or an assessment. So if an individual is not eligible for Medicaid, doesn't qualify for passport due to an inability to meet financial or level of care requirements, or a person chooses not to enroll because of a perceived stigma or a reluctance to trigger the estate recovery process, we make a community referral. And until this point, we would make those referrals, and essentially we were able to say, here's the information, and if anything changes, please give us a call. And that community referral may land them with the local community action for transportation or nutrition assistance, the senior center for adult day services, or any of those services offered within the scope of the Title III of the Older Americans Act, or they may not land anywhere. After 30 to 45 days from an individual's community referral, the community health worker will call that consumer and say, hey, did you make that connection? Did you get your needs met? Were you put on a wait list? Have any of your needs changed at all? In some of the cases, the individual may just need a warm handoff, just some help making the call. If their needs have changed, maybe their level of care has changed. So that may result in a referral back to our front door for screening and assessment for waiver services. The touch points and the data that these community health workers provide are helping us to ensure that individuals are getting connected to the care they need. Those activities and many more of the activities of the council relate to and align with the Sapa. The community health workers have helped us to address several objectives within the Sapa, including improvements in healthcare coverage and affordability, home and community-based supports, home care workforce capacity, and caregiver support. And both the community health worker and the mobility management programs are leading to improvements in social inclusion, mental health, nutrition, and access to transportation. The Sapa strategies and objectives have opened new avenues of thought. We often become comfortable in our implementation strategies, and at times we need encouragement to look beyond what we have already accomplished and the way we've always done it. And the Sapa has really encouraged these innovative programs and partnerships and collaboration. So why should other partners be interested in implementing the Sapa? In short, we are all aging, and we are all going to either age or take care of an aging individual. And all of our state partners can and should be working together to implement the programs that improve the outcomes of our older Ohioans. All of us can enable funding for these programs by working toward and reporting progress on the common measurable goals that are outlined in the Sapa. And all of us can work toward supporting positive aging and improving the well-being at all stages of our lives. So again, I want to thank ODA for inviting me to speak today, Director McElroy for her leadership, Ashley Davis for her work to support the efforts of the Ohio Advisory Council on Aging Best Practices Committee. I wouldn't want to leave without mentioning the Ohio Advisory Council on Aging and the amazing leadership of Lori Wingard, who serves as our president. The council has been engaged and actively providing input to ODA as they search for ways to ensure the SAPA is an active, living, breathing document, and that the action plan is implemented across the state and outcomes are measured to ensure that our actions are having an impact. So I look forward to doing my part to implement the SAPA in rural Southeast Ohio, and I hope all of you take something away from this webinar and join me in that effort. So thank you again for allowing me some time to speak.
Thank you so much, Misty. Thank you for that call to action. Thank you to all our guest speakers. We really appreciate the practical examples of how you're putting the Sappa into action. I'm going to let Alana throw our slides back up for us. Fantastic. And we know that we have shared a lot of information with you all this afternoon. So this is a really great time to pause, see what questions you all have for us, for the HPIO team, for the ODA team. For Misty, who is our only guest speaker live with us today, if you have questions for any of us, please feel free to throw those in the question box or into the chat. We'll be keeping an eye out for those. In addition to that, we'd love to provide another opportunity for discussion. So another opportunity to type some things into the comment box or into the chat. We would like to hear from you on how the Sapa Toolkit could be useful in your work. All of the different pieces of the toolkit that Carrie and Stephen shared with us, which of those stood out as being particularly useful, impactful, you're looking forward to getting your hands on. And then in addition to that, what other technical assistance on the Sappa might be helpful. So we'll keep our eyes on the question box and on the chat box. I see Morgan has popped up here. Give you a minute to formulate your questions or participate in the discussion. We would just love to hear what from our presentation about what the Sappa Toolkit includes and our guest speakers' presentations on how they're using the Sappa, what ideas sparked for you?
And Haley, I'll jump in while we wait for folks to kind of come up with some questions and discussion. There are a couple of the questions that came in on the chat feature during the presentation were around receiving hard copies of the Sappa. And so some of you may have seen that we do have a folder that comes with the summary assessment of older Ohioans. It comes with the Sappa itself and an executive summary, and we will be expanding that to include the toolkit, because we know that having hard copies can be really valuable for in-person meetings. And I know I love to jot notes on things and write things up. So we will be having some hard copies available. I put in the chat box an email address that you can definitely shoot us a message and we can get that over to you as well.
Fantastic. Thanks, Ashley.
Yeah, and our email address too is also on our webpage. So again, that's aging.ohio.gov/Sappa. So if you forget the email or you lose the sticky note that you jotted it down on today, you can always go to our webpage and reach out to us via that email for any needs about the Sappa or questions that may arise over time. So,
yeah. Great. And one of the questions that has just come in is about how do we utilizing the Sappa, the toolkit itself. So the question is around, is the toolkit just to be utilized as a helper, a guide, or is it something that requires working in collaboration with ODA and reports to be turned in? So great question, Kathy. We developed the Sappa Toolkit as exactly that, a resource for external community partners to pick up. You do not need to use all of them. You can pick and choose which tools work best for you. They are for you. They do not need to be turned in or anything like that. What I would say is that if you're a really active partner, we would love to hear from you. We'd love to connect with you. Something that Misty said in her presentation was all around aligning our goals and aligning our efforts and really having that kind of combined voice and having that platform together. And so if we are able to kind of capture some data, we can help disseminate successes and move towards an aligned framework. So Nothing required, no reports, no paperwork, but just tools that we'd love you to use.
Absolutely. And you'll find all of those on the ODA website that we linked at the beginning in the chat. We can, maybe one of my colleagues can throw that in the chat again so that it's easily accessible. You'll find the toolkit document and all of the different worksheets and extra resources there that could support the work that you're doing. I'd love to hear other thoughts. Thank you. My colleague Jacob just threw that link in the chat. Would love to hear other thoughts about how the toolkit can be useful. We heard earlier in the poll about which section of the toolkit you're most looking forward to using. I wonder if any of you have thoughts about how you'll be using those sections and what additional partnerships you're looking forward to building, or strategies you're looking forward to digging into.
One thing, Haley, I can share also while we're waiting for folks to come up with some things. I think that our guest panel today was really amazing, because I think they bring different perspectives and how the Sappa can be used at different sectors and different scales. So we had Annette, who's the president of the Ohio Adult Day Health Association and the Gilchrist Senior Center. So she's looking for strategies that are falls prevention, financial exploitation, really very specific strategies that can enhance her adult day facility. And then we have Amy, working on the state level with health systems on age-friendly health systems. So different work, but also common measures, common goals. Same with Misty, working at a regional planning commission, as executive director of that. So different sectors, and with Misty really looking at our social determinants of health and our transportation and planning and housing and utilities and aging, all of those incredibly important community condition sectors. So I think it shows like a great different sectors and how to use it.
We also heard lots of really great examples from our guest speakers about partnerships between sectors, between organizations, which is really exciting and is a really important aspect of moving this work forward. So that was fantastic too.
So maybe we can hop forward, Haley. And so what we would also say is please connect with us. We would love to be your partner in this. Morgan, I think, will share again our website. I think it's in the chat box as well. And I'm going to talk a little bit about looking ahead and moving forward with this work. All right, I'm not sure if I have. Oh, we have a couple more questions coming in now. Okay, so one of the questions is around, are there any regional, from Sally Bullen, are there any regional local initiatives being facilitated to help community-based organizations implement activities? Also, is funding available to support these efforts? So great question, Sally. I'll start at your second question, then we can hop back up, and I'll see if Morgan also has some ideas as well. So I would say for the funding, we are looking at any funding opportunities that do come out of the department. We want to align. This is really our foundational strategy, and we will align any additional new funding opportunities, whether they're new funding opportunities with funding forthcoming to align with these goals and visions. And then Morgan, do you want to take the first part of that question? I see some other questions coming in too.
Yeah, I'm trying to find, there's so many coming in here. So regional or local initiatives being facilitated to help community-based organizations and AAAs collaborate. So we're actually working currently with the AAAs on their strategic area plans. and our new state plan, which will be submitted to ACL in July. And that will be built on the foundation of the Sappa. So our new state plan, Ashley will touch on this in a minute, but it will be for the next 4 years. And the conceptual framework of the Sappa is really what is informing our new state plan, and really carrying that over into the AAAs and all of those local and regional initiatives. So definitely plan to see the Sappa woven into all of those local efforts.
And I think I want to go back to a little bit about how the Sappa was developed, because we did, and it was a good process, right? So many of your organizations were a part of that process, that almost year-long process that went on that journey with us. We had work groups and stakeholder meetings and working sessions, and we had about 71 organizations engaged. And so that is why we really believe so firmly in it, because we really wanted to do that in partnership with organizations in the aging and non-traditional aging network. It looks like there's some connections being made in the chat box as well, which is great. Using this a little bit as a networking, which is great. All right, so I'm going to move us ahead and looking ahead and talking about where we're going from here. So we recognize that this was a lot of content within this last hour forum. So we do encourage you to check out the toolkit and where you align. Looking ahead, though, Ohio Department of Aging will be updating our 4-year state plan on aging in the summer of 2022. So this summer, we will include, like Morgan said, the Sappa framework and efforts as the foundation of this new state plan on aging. And the state plan really, it guides the aging network. It guides the Older Americans Act funding and services within our state for the next 4 years. So we're using all these tools, all of this work to really be our foundation for that next 4-year state plan.
Yeah. Our hope really is that after today's webinar, everyone that attended will hopefully have the tools to implement the Sappa and move Ohio toward a more comprehensive and coordinated system that really empowers older Ohioans and advances healthy aging, elder justice, and equity. So the tools that we outlined today and the content that is posted on our website for the Sappa, it will all be very critical and beneficial in moving our new state plan on aging forward in a very thoughtful and strategic manner over the course of the next 4 years.
I want to thank Misty, Annette, and Amy for your contributions today. Your efforts, your leadership surrounding this work has really been inspiring and invaluable. Just a reminder to visit our website for all these Sapa resources. And we really thank you for spending some time with us today. And we wish you a great afternoon and stay warm out there.